CARE Learning Tours program is being funded by the Bill and Melinda Gates Foundation. We're going to take 6 trips over the next 3 years to different countries all over the world to really examine the issue of maternal health.
The learning tours are such a unique opportunity. They offer something on the front lines of this work for people who can influence policy to really see how this all works and comes together, and really see those people who offer training, offer counseling, offer health services, offer educational opportunities, and they get to see it firsthand.
This is the kind of tour that hopefully will give people the understanding to take back to policymakers so that the kinds of programs that the U.S. government supports will really meet the needs of people in countries like this.
Ultimately, on these learning tours trips, we want to affect policy change. We want to reach leaders, the right leaders, global leaders, and get them to really champion the issue of maternal health. Maternal health has to be a right for women, and they deserve a chance of life. And ultimately, when a mother survives, her children thrive.
I've had 2 children, and when you compare the experience of childbirth, these are women who are walking while in labor miles to get to a facility where there isn't even a light, let alone a physician. So there are some serious challenges.
We've gotten really good feedback from the trips we've done already. Members of Congress have very limited time. They need things packaged in a certain way. And we've laid out a really structured, well-managed program where we take just 3 days of the member of Congress' time, their staff. We've given them full briefings. A week before they even arrive, they've got an entire briefing book of all the things that they're going to see. And then each day we give them an updated schedule. It's minute by minute.
There's nothing better than seeing things on the ground and actually talking to the folks. We always had an interpreter if we couldn't speak the language.
We take them through the entire health system structure, from the dispensary and meeting the community health workers all the way up to the national hospitals. We then also include some high-level delegation meetings with members of local parliament, ministries of health, and other government officials, all the way up to the Prime Minister and President level.
The government makes a lot of decisions as far as not just funding levels for, say, international assistance programs, but also the policies, foreign policies that we pursue as a nation, which can have a tremendous impact, I know, on the lives of people in countries like Kenya. So I think it's important for folks to come here and meet with these kids and see how they're living and the things that we do that have an impact on their lives, so that we can do things maybe better and differently going forward.
How can you make a decision about an appropriation or about a policy unless you see it for yourself and talk to the people, listen to them, walk where they walk, talk to them, ask them questions, answer some questions. It's been a great experience so far, and I'm learning a lot.
We're able to take our delegation way off the beaten path to these really unique settings. We have an opportunity to meet families in their homes. We've been able to put an amazing team in place that ensures our safety, our security. We also have a medic with us at all times, cars, drivers, you name it. It's a well-oiled machine.
All of those beautiful faces of the women and the children have just morphed together for me. It's, I went to sleep last night thinking of all of those different faces and the eyes and the needs and the concerns they had, but with the idea that they were getting more help now than in the past, and I know that we can do a lot more.
And there's really no substitute. You can tell these stories, but the power is truly in bringing people to the stories.
I thought it was a wonderful opportunity to, further my education in these areas and these issues. So, you know, I wish every staff person in Congress had the chance and the good fortune to do what I've been able to do. I think it's a real privilege that I've been able to meet with these folks and do some of the things and experience some of the things. I mean, I'll never forget this experience. I'll take it with me for my lifetime.